If your cat sneezes once in a while, don't worry. It's most likely nothing to be concerned about. However, if your kitty is sneezing excessively or has other symptoms along with it, it may be something more serious. That's why it's important to know why your cat might be sneezing and when it is time to take them to the vet. In this video, I'm going to tell you 8 reasons why your cat might be sneezing and what you can do about it. If this is your first time here, welcome. I make cat videos that are educational and entertaining. Number 1, your cat has an upper respiratory infection. Cats can get upper respiratory infections, also known as UTIs, from a variety of viruses and bacteria. These infections can cause inflammation of the tissues in your cat's upper respiratory tract, which can lead to sneezing. Other symptoms of an upper respiratory infection include coughing, discharge from the nose or eyes, and difficulty breathing. If you notice that your cat is sneezing and has any of these other symptoms, it's important to take them to the vet right away so they can get treatment. Most upper respiratory infections are contagious and can be passed on to other cats. So it's important to keep your cat isolated from other cats until they've been treated. No. 2. Your cat has been exposed to smoke or other irritants. If you've recently been around your cat, smoke or other irritants like cleaning chemicals, it could explain why your cat is sneezing. In some cases, your cat may also have inhaled a foreign object that's causing their sneezing. If you suspect that something in the environment is causing your cat's sneezing, try to identify and remove the irritant from their environment. You may also want to take them to the vet for a checkup just to be sure. No. 3. Your cat is allergist. Just like humans, cats can develop allergies to things like pollen, dust, and certain types of food. In fact, one study found that up to 10% of cats suffer from some type of food allergy. If you think your cat may be allergic to something, talk to your vet about doing an allergy test. Once you know what your cat is allergic to, you can take steps to avoid exposing them to that allergen. This may be difficult to do if it's a seasonal allergy, but there are also year-round allergens. There's no need to worry if your cat sneezes year-round. 4. Your cat has a foreign body in their nose. If you suspect your cat has a foreign body stuck in their nose, it's important to take them to the vet right away so the object can be removed. A foreign body stuck in your cat's nose can cause them to sneeze excessively. They may also have a runny nose, a swollen face, or difficulty breathing. The sooner you get the object removed, the better. And if you can see the object, you may be able to flush it out with water. However, if you can't see the object or reach it, take your cat to the vet so they can do it for you. 5. Your cat has feline herpes. Feline herpes is a viral infection that causes sneezing, fever, lethargy, and ulcers on the cornea. It's highly contagious and can be spread through direct contact with an infected cat or by sharing food or litter boxes. If left untreated, feline herpes can lead to pneumonia. It's important to take your cat to the vet for treatment. Unfortunately, there is no cure for feline herpes, but there are treatments available to help relieve your cat's symptoms. With proper care, most cats with feline herpes will make a full recovery. 6. Your cat has been exposed to a cat with chlamydia. If you've been around a cat with chlamydia, it may explain why your cat is sneezing. Chlamydia is a bacterial infection that can cause a range of symptoms, including conjunctivitis, pneumonia, and urinary tract infections. In severe cases, chlamydia can even lead to blindness. If you think your cat may have been exposed to chlamydia, take them to the vet right away. Chlamydia is highly contagious, so it's important to keep your cat isolated from other cats if possible. Fortunately, chlamydia is treatable with antibiotics. 7. Your cat has dental disease. Believe it or not, dental disease is one of the most common health problems in cats. In fact, 50% of cats over the age of 3 have some form of dental disease. Dental disease can cause pain and inflammation, which can lead to sneezing. If you think your cat's sneezing may be caused by dental disease, take them to the vet for a checkup. Your vet will be able to examine your cat's teeth and gums and determine if there is a problem. If necessary, they may take x-rays or perform a procedure called a dental prophylaxis. 8. Your cat has certain conditions. Certain conditions like hyperthyroidism and diabetes can also cause your cat to sneeze. Hyperthyroidism is a condition in which the thyroid gland produces too much thyroid hormone. This can lead to a range of symptoms, including weight loss, increased appetite, and sneezing. Diabetes is a condition in which the body does not produce enough insulin. Insulin is a hormone that helps regulate blood sugar levels. Without enough insulin, your cat's blood sugar levels will rise, which can lead to excessive thirst and urination. In some cases, diabetes can also lead to sneezing. If you think your cat's sneezing may be caused by one of these conditions, take them to the vet for a checkup. Your vet will be able to run tests and diagnose your cat. When to worry about your cat sneezing? Now that you know some of the most common reasons why cats sneeze, let's talk about when it's time to worry. As I said before, if your cat sneezes once in a while, it's probably nothing to worry about. However, if you notice that your cat is sneezing excessively or has other symptoms along with it, it may be time to take them to the vet. Some red flags that indicate your cat needs to see a vet include sneezing that occurs in conjunction with a high fever, lethargy, loss of appetite or weight loss, difficulty breathing or eating, nasal discharge, eye discharge, swollen eyes or face, or a runny nose. If you notice any of these symptoms, it's important to take your cat to the vet right away. Early intervention can help prevent the problem from getting worse. Also, if your cat is an indoor cat and hasn't been exposed to anything that could have irritated their nose, you should take them to the vet. How to help your cat stop sneezing. If you've taken your cat to the vet and they've been cleared of any underlying medical conditions, there are a few things you can do at home to help your cat stop sneezing. First, make sure your cat has plenty of fresh water to drink. This will help keep their nasal passages moist and prevent them from drying out. You can also try giving your cat a humidifier to help add moisture to the air. If your cat is a chronic sneezer, you may want to consider getting an air purifier to help remove allergens from the air. In addition, you can try feeding your cat a bland diet made up of boiled chicken and rice. This can help soothe their stomach and prevent them from vomiting, which can lead to dehydration and more sneezing. Finally, make sure to brush your cat regularly to help reduce shedding and minimize the amount of hair that gets into their nasal passages. The bottom line is, if you notice that your cat is sneezing excessively or has other symptoms along with it, it's important to take them to the vet. Don't try to diagnose or treat your cat at home. Let a professional handle it. With prompt veterinary care, most cats make a full recovery from their respiratory infections. So don't worry, your cat will be back to their old self in no time. Thank you for watching. We hope that you enjoyed this video. If you did, please give it a thumbs up and share it with your friends. We would really appreciate it. And don't forget to subscribe so you never miss any of our videos.